So I did a research project with Westminster College. Kind of just with like my family history, I had some interest in breast cancer rates among, Native Hawaiian Pacific Islander women. And so I started researching the stats for our state, and we found that Native Hawaiian and Pacific Islander women in general just have higher rates of breast cancer, but then they also have like a higher mortality rate. And I kind of wanted to figure out why that was happening. And so we found that women were still going in for their scans, but they were waiting until later. And that waiting kind of put them at higher risk for breast cancer or for the breast cancer to be more developed. A lot of times that could be because maybe they didn't feel comfortable with their healthcare provider. And so like if you don't feel comfortable with your healthcare provider, like try and search for someone else, like if your friend has a good doctor that they like or something like that. Or if you want to take like a family member with you to go to that doctor's appointment, then that's totally fine and you should do that because it's for your benefit. Just like a focus on educating yourself that like, yes, cancer can be scary, but if we put off, those screenings and things like that, it's going to affect us worse in the long run. And so it's better to go in and get checked out than to try and avoid that, because it can be a lot harder in the long run. So just go in as soon as you can, get those things done, take a friend, I don't know, like have a girls' night and you guys can all go get like mammograms or something, I don't know, and then go get like ice cream, right? Because mammograms aren't that fun, but just things like that so that you're getting it done, you're taking care of yourself, and then you're looking out for others within the community as well.
Knowledge is power, right? And so knowing our family on both sides, that will help. I remember that when my mom was diagnosed, that became more prevalent and very clear. And I think it was even Amy who had suggested to my sister to get that genetic testing and make sure.
So she has BRCA gene.
Yeah. And so after my mom had it, my auntie her sister was diagnosed with it too. So myself, and then passing that down the line, my boys, but also my girls will need to be checked a little bit sooner than maybe what the doctors normally say is appropriate.
I know as far as my kids go, they're very aware of having a healthier lifestyle and very aware of what they put into their bodies and not all of them, but most of them, try to eat healthier and exercise a lot more regularly. And I think that those type of things can help prevent a lot of problems that you can have, not just cancer-wise, but anything. So I feel like that's knowledge that my kids kind of got to learn the hard way. But I think it's really important that they have, I don't know, that's like their base, and they're going forward through their lives with that knowledge, and that's how they look at things now. Is what can I do to make sure that's not going to happen to me?
Yeah, for sure. As Polynesians, we do tend to be more susceptible. There's a higher likelihood that we can have cancer. So even though an auntie or cousin, second cousin has that within the family, understand that and get to know more about it, because you don't know when some of those symptoms may pop up and all of a sudden a health issue pops up that you weren't expecting. And it's not just cancer, it could be, diabetes or something else. So for sure, educate ourselves.